Hi, I'm Dr. Shravani Karmuru, Consultant Internal Medicine, Renova Hospitals, Langerhaus. Today I am going to talk about a stage in diabetes called prediabetes, which is now more often termed in the health checks or health checkup status of the people. This is more commonly we are seeing nowadays among the adult and middle-aged persons, and as well the younger people also. So I just want to give a brief information on this to make aware of what is the term describes and how we can manage it. What down the lane we have to monitor on ourselves to keep that reversible or to keep it not progressive to the over diabetes stage. And coming to that pre-diabetes stage is defined as a stage in impaired glucose tolerance by the body, stating blood glucose levels more than in normal range but less than the clinically defining diabetic levels. Like it is more than the normal range of the regular blood sugars, but somewhere in between the mark defining the diabetes, like less than or equal to 126 but more than or equal to 110, the normal range. So in this stage we call it as pre-diabetes stage, and the person in this stage poses a high risk for the further progression into over diabetes or clinical diabetes condition. So to prevent or to stop the progress of this situation or condition and get back to the normal range or a normal euglycemic state, the patient needs a few things to be changed from his side as well as the medical advice. First of all, I'm going to say who are the people who has these pose this high risk for the pre-diabetes stage. The community of people who has this high risk for this pre-diabetes stage are the people 45 or more than 45 years of age, obesity, sedentary life, the people who have more of sedentary lifestyle, and genetic history or family history like siblings, father, mother who has already in diabetes, and pregnant women who develop diabetes during their pregnancy, and people who has other health issues like thyroid, kind of metabolic disorders are at high risk for the pre-diabetes stage and over diabetes stage. So as such, with the general population, this particular community of people should have a high third eye on their diabetes stage, pre-diabetes risk and management to reduce the risk to the further diabetes stage. So how? So once we are diagnosed with this pre-diabetes, there should be some lifestyle modification to keep that impaired glucose tolerance at bay and into remission, like continuing the lifestyle modification in terms of balanced diet and low calorie diet, cutting down the excess weight through a balanced diet plan or other means, over a 5 to 10% of sustained weight loss, and keeping some physical activity for at least 20 to 30 minutes at least 5 times in a week, and progressive follow-ups and monitoring of the blood sugar levels will help them keep the pre-diabetes stage into a euglycemic stage, and also preventing the journey down into the clinical or over diabetes. And annual health checks along with your physician is also very advisable to see the overall health status of the pre-diabetic patient. Thank you.